So then I would like to welcome you all to this lunch conversation with former Director General Johan Carlson. On March 11, 2020, WHO declared the COVID-19 pandemic. I don't think any of us could at that time foresee the enormous implications this pandemic would have on global health and people's lives. Health authorities, governments all around the world had to make extremely difficult decisions on a very inconclusive knowledge base. And Sweden's response strategy has often been described as an outlier, both in Sweden and outside Sweden, I believe. And one of the persons ultimately responsible for this strategy is you, Johan Carlson. So I'm very glad that you will be here and explain a little bit about the strategy and what, if and what that is that deviates from other countries' strategies. If we just start by the Swedish strategy, it's often it's described, I would say, in very different way depending on who you ask. So if I ask you, who are responsible, how would you briefly describe the Swedish response strategy for the COVID-19 pandemic?
Thank you for inviting me to this discussion. First, I would like to say I don't think the Swedish strategy has been so different from other countries. The differences are probably the way we handled it in practice. There are some differences. I come back to that. The strategy, of course, is very much in line with all countries that we have to avoid spreading of the disease by physical distancing, or what we had at that time, and to protect the vulnerable. And if you compare COVID-19 to other diseases, it was very much age-dependent, the vulnerability, much more than we're used to. I mean, usually, of course, there is an age dependency always, but very much also background diseases. In this case, it was much more age-dependent, the morbidity and mortality, people suffering from disease or even dying. So that was the basic strategy. But when doing this, we were also falling back to many years of experience. And I think very many of our colleagues in Europe, we had a lot of contact, agreed upon the in principle. The thing went very quickly political, I would say, in many countries. We tried to stick to what we know, that voluntary measures are the most effective measures. We have a voluntary vaccination program in Sweden with a coverage rate of 97–98%. We have obligatory vaccination in European countries with 75% of coverage, for example. So the voluntary sort of principle is based very much on education. It's very much the same as we talked about in the other seminar here. You have to inform people, educate people, increase the health literacy, so to speak. Why are we doing this? Why should you do that and that? For example, why should you practice distancing? Why should people with the age of above 70 have an even higher they're at a higher risk, and they should be even more precautious in this. The other thing is that we didn't want to implement or to institute measures that would cause more harm than help. You don't give the patient a medicine, a remedy that will kill the patient.
Hopefully.
Sometimes you do. That was very much the case here. I mean, we've seen horrifying pictures from China. We all saw that and said that, no, this is not happening, will not happen in Europe. We will not lock in people. We will not prevent them from walking in the parks and doing things. But that happened. We were very much into that we should try to focus on the things that made the difference. The distance, not walking together with your partner in the park, not jogging out in the forest. And the third pillar was we were very convinced of not closing the schools. At the end of the day, we were one of the few, maybe the only country, not closing down the schools.
And why was that?
That was also a public health measure. We know that the health of the children, especially the mental health of children, is very dependent on well-functioning schools. If you talk to people, my friends and your friends here, living in good housing conditions, good living standards, and being able to help your children if they're not at school, that's probably not a problem. But a large proportion of the population has another situation. The school is the only safe place for many children. They have unstable homes. They have homes without any background in sort of teaching, helping them out. They could have all kinds of problems, etc., etc. And we knew we have followed that for many years in the agency, the mental health or the well-being of children, and it's very much dependent on open, well-functioning schools.
But was that knowledge something unique for Sweden, or?
No, I don't think so. But obviously, it wasn't. Some countries thought that could be worthwhile. And I think one thing also that you have to think about. There was a movement in many countries, even in Sweden, that people thought that this will be short-lived. You could stamp it down by non-medical measures, by closing down, by lockdowns, so-called lockdowns. In a few months, it will pass away. It could be worthwhile closing the schools for a few months. That will be now. After 2 years, we see this was not the case. We never thought this was to be the case. And even in Europe, you saw countries. Europe was very unevenly affected at the start. I mean, Western Europe, Sweden, some extent Denmark, but especially France, some parts of Germany, etc. When the summer came in 2020, it seemed that the pandemic had disappeared, and some countries sort of celebrated that we made it. They took lockdown measures, and then it came back, and they have enormous problem despite all these measures taking. So there's very little that will tell you what would be the best way of doing it. Yeah. We've come out quite well when it comes to mortality, one of the lowest mortality rates in Europe. And we've come out very well when it comes to children's health, I will argue. We've kept it open, the health promotional system, the school health, and the schools themselves have been open for children up to 9th grade, 16, 17 years old.
But how come that you could make that decision and or draw those conclusions in March and April 2020 when no one else came to the same conclusions?
I think quite a few public health agencies came to those conclusions, but it's very much a matter of how receptive the politicians were. We've had. And I wouldn't out any country here, but I mean, we've had very close contact. We've been in very close contact, and I've been traveling a bit now, talking to people, and I think that's this is common knowledge. But a little bit, a number of countries copy the way of the Chinese did, because it seemed to disappear in China, and the Italians started with lockdowns very, very early, and they have not a very favorable outcome. So I mean, I think our politicians, we have also a different tradition in Sweden with rather independent agencies taking decisions. Of course, the government could have sort of overthrown that by implementing things, but we had a very good dialogue with the government office, the ministers, and I met with the Prime Minister dozens of times in the early phases, and we discussed this in depth and how we felt about the situation.
So, if I understand you right, it's You came to the same conclusion as your colleagues out around in the world, but the biggest difference is that the politicians didn't interfere so much in Sweden.
I haven't had contact with all colleagues, of course, but quite a few of the colleagues we interact with had. And even WHO commended us on, for example, open schools. I think now all countries realize you can't close the schools. You shouldn't close schools unless it's necessary, unless the children get ill, of course, and you can't be there, or the teacher. But in the early phases of the pandemic, children did not drive this at all. Now everybody will get it. The Omicron is different. But early phases, we didn't see higher incidence in teachers. We didn't see high incidence in children. Neither did the Chinese. So that was quite so. Then I wouldn't, you have to realize we had problems. We have serious problems in Sweden when it came to elderly homes, nursing homes, etc. Systematic problems, of course, that needs to be addressed.
This must have been a tough time being a leader. You were then the director of the Public Health Agency, and you had to make big decisions with huge big impact based on very little and inconclusive knowledge. How did that affect you as a leader? This is the end of your career, so to speak.
Yes.
Sorry.
Yes, and that's probably a positive thing. I mean, it's if you're new and if you sort of have very high ambitions, what will happen to you in 10, 15 years, maybe you're more unlikely to go your own way a little bit. I had, when it started, been director for the agency for 11 years. For the public health and the predecessor, which was the communicable disease agency. And we had a lot of experience. I have hundreds of skilled staff, collaborators here. And we had an extensive, as I said, collaboration with, especially within Europe and with the WHO. So I mean, I thought we were on the right track. Of course, when, especially in the basic principles, could this be stopped by lockdowns in 2-3 months, which was a mantra that many countries, politicians had. Yes, let's do this, and then it's over. We were quite convinced that a disease like this, a disease, an upper respiratory disease, contagious disease, would not be possible to stop by simple means like that. The other thing, of course, is that lockdown is a kind of a phrase that doesn't really tell you what it's all about. No countries are in lockdown. Countries close shops, restaurants, cinemas, hairdressers. But I mean, the basic industry, the keeping the country going, transportation, food, everything is there, and we also try to focus on where are the critical areas, and the critical areas are to some extent the workplace, if you work close, and the other thing would be family, and to influence how families, how people do. You need to educate them. You need to tell them, because we need to have this. Now people say, okay, all restrictions will go, and this will happen in Europe now. I mean, even in our country very soon. But we still need to keep up the mentality, not to push it too much, because we need to live with the COVID-19/Omicron for a while, and it's less dangerous, but still there are quite a few people that need hospital care, even intensive care. So what we could offer now is vaccination and cautiousness for special events, and that's something. It's not an on and off prohibiting people to do things. You need to get people to think and act on what we know about it, and that of course has changed over time and increased.
During these 2 days, the focus is co-creation and cross-border learning. So 2 years into the pandemic, if you take a look outside the Sweden and different countries' response strategies, which one would you like that you had been inspired by earlier?
I think you have to realize we can't. All strategies, all actions need to be based on what is feasible in that country. I've talked a lot to my colleagues in Southern Europe, and they say we could never have used the Swedish way of doing it because people are not used not to get very firm regulations. You can't tell them to try to avoid go to the store, try to avoid do that and that. Unless it's prohibited, people will do it.
So in this case, cross-border learning isn't really an option.
There are learnings, of course, and I think it's a little bit early to say because we don't know yet. I mean, if you look all over, it's a pattern. It's not a uniform message from countries. It differs, and of course the healthcare systems are different, and the legal systems are different. I mean, in Sweden we don't have any legislation that could prevent people from invite neighbors to their home. We can't prohibit people to go out in the shops, for example. We can't close them down unless we institute very, very hard and new legislation. Other countries could do that, or they did it anyway. I think it's a little bit too early to draw conclusive lessons. What I like to say is that what we need is the cooperation, the discussion we've had with our European counterparties, and I even had a discussion with the Minister of Health here in the Emirates at one stage, where we were sort of sharing idea, has been very good, very, very interesting. And we need to see because what I think is that next time, or if this comes back, lockdowns and this kind of harsh methods will not be used. I mean, people. We need to try to teach people how to cope with this, how to behave, how to do it in everyday life. And that doesn't only go for, as you know, it doesn't only go for COVID. We haven't had influenza the first 18 months. The calicivirus disappeared. People started to wash their hands, which is surprising that they didn't do before, and etc. etc. There are lots of things that we could benefit from, and I think it's. No, I wouldn't say that people should have used our strategy, our methods, and I'll be happy to look into what are there any specific areas that are. One thing, of course, is that we have a very decentralized system in Sweden, which is beneficial when it comes to AMR and sort of developing healthcare. But it's tricky when you are supposed to institute measures that go over the borders between countries, etc. And some of the countries, some of the regions are very small. We have regions down to 50,000 people. I mean, trying to mobilize resources, trying to do things, it's difficult when it comes to testing, contact tracing, etc. That's something we need to think about. Should we centralize certain things in our country rather than go other way?
If you could talk to Johan Carlson back at March 2020, what would you say to him?
Try to keep calm. I managed fairly well to do that, but of course, some nights, some days were, of course, difficult because, as you said, nobody knew anything. I mean, you couldn't look it up in the book, and not even in Wikipedia. You didn't. But I think you have to realize when you come to a situation like that, try to stick to the basic principles. why should this disease be so different that you couldn't apply the basic principles of communicable disease control and public health? Because, as I said before, I think it's important not to give the patient a remedy that it will suffer from.
Johan Carlson, thank you so much for sharing these experiences with us. And I think you will stay here for the next panel, right?
Thank you.
Yes, thank you.